Director Rogers is going to provide a bit more of an update, but just to set the table, over the past 24 hours or 16 hours, a number of individuals who have been affiliated with our response operations have developed signs and symptoms that could be related to COVID-19. We have taken appropriate steps, and those individuals are being assessed and tested, as Director Rogers will note. But before I turn it over to him, I just wanted to note that there has been no interruption in the state's overall response to COVID-19. For many months now, the operation between Maine CDC and Maine Emergency Management has been a joint operation, and much of that has already been being done virtually. Today's shift, because of the individuals who have become somewhat symptomatic, takes that from predominantly virtual to fully virtual as we assess the situation. But I just would like to repeat, there has been no interruption in the state's response to COVID-19. We plan for continuity of operations situations, and this is one of those situations. So I'd like to turn things over to Director Rogers.
Thank you, Director Shaw. As Dr. Shaw said, my name is Peter Rogers, and I'm the Director for the Maine Emergency Management Agency. This morning, as we were getting ready to open the State Operations Center, we received phone calls from a number of our staff, 7 total, who said that they were experiencing flu-like symptoms that became evident this morning and late last night. They had similar conditions where there was fever, chills. Some of them had aches and pains and some joint fatigue. I immediately called Director Shaw, and we jointly decided to activate our continuity of operations plan and deploy to our alternate work sites. That was at 8:05 this morning. We worked with the National Guard to set up a swab site to facilitate the testing of those 7 individuals. And I'm happy to report that is ongoing, and they are still on site now, and many have gone through. The staff joined remotely this morning after we sent everybody home from the State Operations Center, and we joined on a Teams call to get our operation back in order where we are fully mission capable. There's nothing new to us about this. We practice this just like we do all of our plans, whether it's a hurricane, a earthquake, flooding. We do this all the time. We have months ago started working on Teams and started working remotely and testing that remote capability over the past few months. Every Sunday we work remotely and continue the mission. At the outset of this pandemic, we implemented safety protocols at the state EOC that help protect us against the spread of this virus. Very aggressive steps, I might add. We do temperature checks. We have everybody fill out a questionnaire to make sure that they haven't traveled, they aren't feeling sick. They hand sanitize before they go in every single room in the State Operations Center. We limit the number of employees. And a number of months ago, we actually cut our staff in the state EOC and all of our emergency response team members and sent them to work the continuity of operations plan at home. So recently, we usually have 10 in the emergency operations center and 4 or 5 in the CDC room. So we have significantly cut the staff. Again, we have prepared for this. We work hard to do it. We're working today. We'll be working tomorrow. And we have tested it. It works. And we continue to go mission capable. Thanks.
Great. Thank you, Director Rogers, and thank you for joining today. I'd like to go to the public health aspects of the briefing now, and then, of course, Director Rogers and I are available to take any questions you may have. Overall, unfortunately, today's briefing, albeit virtual, begins again on an unfortunate and somber note. There have been 3 additional individuals across the state of Maine who have tested positive for COVID-19. Who have passed away with COVID-19. One was a man in his 80s from Cumberland County. Another was a woman in her 80s, also from Cumberland County. And the 84th was a woman also in her 80s and also from Cumberland County. These deaths come as the United States as a whole marks a grim milestone in the number of individuals who have passed away with COVID-19. Yesterday, the United States crossed 100,000 individuals who have passed away nationwide with COVID-19. These 82nd, 83rd, and 84th deaths in Maine mark a similarly grim milestone. We, all of us at the state, continue to send our deepest condolences to each and every one of the family members, not just in Maine, but across the country, who are grieving the loss of now 100,000 individuals across the country. Overall, there are now 2,189 cases of COVID-19 across the state of Maine. Of those, 1,951 are confirmed and 238 are probable, for a total increase of 52 cases since yesterday. Currently, 264 individuals are hospitalized, an increase of 4 since yesterday, and 58 are currently in the hospital. Of those 58, 22 are in intensive care units and 14 are on ventilators. As I mentioned a moment ago, sadly, there have now been 84 individuals across the state who have passed away and 1,402 who have recovered. Of our 2,189 cases, 518 are among healthcare workers. Since beginning our work, Maine CDC staff members have now fielded 7,775 requests for consultation or clinical advice from healthcare providers across the state. I'd like to take a quick moment to provide an update on some of the ongoing outbreaks that Maine CDC is engaged with. First, I'd like to talk about 3 new outbreaks for which we've just opened investigations. The first is the Happy Haven home, which is a home for individuals with IDD, where we are aware of 3 cases. Next is the Milestone facility. We received reports yesterday of cases associated with that facility, and upon conducting an initial investigation, did find that they were epidemiologically linked. We're currently, and thus have opened an official outbreak investigation at the Milestone facility, where we are aware of a total of 5 cases. And then finally, we are beginning our investigation into a manufacturing facility associated and operated by Procter & Gamble, where we are currently aware of 7 cases. That investigation is underway right now. In terms of existing outbreaks that we've talked about over the past several weeks, at the Cape Memory Care Center, the total number of individuals who have been affected stands at 69, and retesting is underway there right now. In addition, at the Chimbro construction site, there remain a total of 29 individuals who have been associated with that construction site who have tested positive for COVID-19. And finally, at the Durgan Pines facility, there remain 5 individuals who have tested positive. I'd like to now just provide a quick update on our overall public health emergency preparedness activities. We continue to distribute PPE statewide, and we're also continuing our work on spiritual care and counseling for frontline healthcare workers. Given the number of outbreaks, particularly those that have affected long-term care facilities, we're extending our assistance to those facilities to make sure that all of the staff who work in those facilities, as well as the residents, know that they have someone to talk to in case the situation that they're contending with becomes overwhelming. These outbreaks are extremely challenging. It seems like every minute something is new, and it's something that's very difficult that's coming at you every single moment. And we recognize that healthcare workers have to simultaneously maintain that composure so they can keep taking care of staff, but they also need to take care of themselves. And so that's why we've extended our assistance on that spiritual care and counseling to healthcare providers across the state. So with that, I'm going to turn things over to our colleagues in the media We have a number of questions today. And so today's first question goes to Joe Lawler from the Press Herald. Everyone, please bear with us. This, again, is a brand new format. And so, Joe, are you with us today?
Can you hear me now?
Yes, go ahead, Joe. Loud and clear.
Okay. I was pressing the right buttons, but I wasn't pressing them hard enough, apparently. So sorry about that. Yeah, I guess my first question is just either for Dr. Shaw or Director Rogers. I know you said that this hasn't stopped you from being able to do the COVID-19 response, but has it made it more challenging at all in any way? And could you describe that? And then my second question is just with the expansion in testing, other than being able to test more in congregate care facilities, like after one positive case in congregate care facilities, can you give some examples of how the expansion in testing has changed your response strategy?
Sure. Director Rogers, could I turn it over to you for the first one?
Sure, I'll take the first one. Thanks, Joe. Is it more challenging? Yes, it is more challenging. It's much easier to have a room full of people that you can turn to somebody and say, hey, have you seen this? Do you see that? That being said, we have core mission sets that we do, and we are able to do everything on that list. Can we communicate? Can we reach out to the counties? Do we have redundant systems? We do. We are able to take resource requests. We can do all of that. We've been using Teams, which initially was a little cumbersome, but we've been using it now so often that we've gotten really good with it. And we're able to have all of our meetings virtually if the need be, to the point of every Sunday we actually do that. We work virtually, and it's been working out very well.
Joe, as to your second question about the manner in which the greatly expanded laboratory capacity at our lab in Augusta has assisted our response, I would point to at least two scenarios. The first are individuals who are close household contacts of confirmed cases. Typically, those individuals, if they became symptomatic, would be considered as part of our probable case definition. But now, for those close individuals who might live with a confirmed case, we don't need to wait until we get to that point. We can offer them testing, or their healthcare provider, I should say, can offer them testing, knowing that the Maine CDC laboratory will run that test. The other way is more generally with individuals who have been exposed but not yet become symptomatic. Some of that is in connection with congregate settings, but a lot of it is other individuals who may have been in infrequent contact with someone who later turns out to be a positive or confirmed case. We can now communicate to healthcare providers that that individual can be tested at the Maine CDC laboratory, so the providers themselves know as they're assessing patients, they don't need to worry about whether the lab will be able to run this test or reject the test. The bottom line answer is that Maine CDC's laboratory can run tests provided a clinician believes that any individual could have or may have been exposed to COVID-19. That expansion for us really, truly is a game changer. It removes that concern in the back of the clinician's mind about resource concerns at every turn of the way. We're going to turn next to Mr. Don Kerrigan at News Center.
Good afternoon, Dr. Shaw. Can you hear me?
Yes, go ahead, Don.
Great, thank you. I have a couple of questions. One is about your situation there today. I've been through the screening, albeit a couple months ago there at MEMA that Director Rogers described. And if the virus can get through that screening, what hope do you have of keeping it out of nursing homes?
Yeah, Don, you raise a good question. I mean, one of the things that differentiates COVID-19 from a number of other viruses, even respiratory viruses, is that individuals can potentially transmit the virus before they develop any symptoms. Now, I should say that we haven't received any tests back yet. And so where we go from here will in some part depend on what those test results show. But Don, your question speaks to the challenge of really containing something like COVID-19. With a lot of other viruses, people tend to transmit it only after they've developed symptoms, by which time a lot of folks have already started to stay home because they're feeling crummy. With COVID-19, that's not always the case. We, of course, ask everyone to stay safe. There's already, as Director Rogers has noted, already controls in place within MEMA to socially distance individuals. Even when I'm over at MEMA, we have video conferences via Zoom with people that are in the same location just to minimize the social interaction. So it is a challenge. Director Rogers, I'll turn it over to you as well.
Yeah, that's correct, Don. It's difficult. As you know, the last time you were there, it's tough to get in there. You've got to be very healthy, very well. We do the social distancing. We've begun even more tight on that as things progressed. We normally have, as you know, the full EOC is people shoulder to shoulder, and that is just not the case anymore. So we have limited. We've done it from the start. I'm very proud of my guys who stepped forward with this, and they just really embraced it. And every room you walk into, you hand sanitize. When you come in the morning, you do the temp checks, you do the questionnaires. So it's difficult.
Dr. Shah, my other question relates to the announcement by Governor Mills yesterday that the restaurants in the three counties in southern Maine, Androscoggin, Cumberland, and York, won't be able to reopen for inside dining as originally planned. What level of cases in those three counties, what level of would you say would be tolerable in order to allow them to do that opening? At some point, you're going to do that. What is the metric you will need to see in order to allow that?
Great. So Don, you raise a good point, and I'll say two things. The first is it's partly about where things stand today, the number of cases that are occurring in those counties on a daily basis, the current rate, but it's also about the changes that we've observed in those areas just in the past 5, 7, 12 days. So in terms of where we are today, those three counties in particular have daily rates, aggregate rates of cases that are significantly above everywhere else in the state. The other thing that we've seen is that there have been changes in the numbers of hospitalizations, the number of individuals who are symptomatic, as well as the number of cases. There's been an uptick on all of those. So it's Don, you're asking for a concrete number. We're looking at the data every single day. We're not focused on any exact figure. We're taking a holistic view, as we've always done, to see how they rise and fall with one another. If the trends significantly improve in unison, that tells us one thing. If they continue to worsen in unison, that tells us another. So we're taking a look at the data for those three counties on an ongoing basis. The other piece of it, Don, is that it is partly dependent on the nature of the activity. Indoor dining combines two things that raise concern: duration of contact as well as density of contact. Those are two things in my mind that separate indoor dining from a lot of other types of situations. But we are looking at those data on an ongoing basis, and depending on how they look as a whole, that's when the decisions will be made about when to go forward.
Thank you.
You bet. We'll turn next to Brian Sullivan at WABI.
Thank you both. I guess I apologize if you touched on this at the beginning, but I would wonder if you could tell us a little bit about what these 7 people have in common and what you've learned since you maybe first got these calls, and where you think this may have come from, if it was 3 separate places where they would have gotten it, or if they are all in some common place.
Sure, Brian. Director Shah, you want me to take that?
Yes, please.
Sure. So These folks were in the actual state emergency operations center. So they're in the large room, which is made up of different pods of tables, if you will. Interestingly, each pod has 1 to 2 people. That's how we've spread it apart, all well over 6 feet apart. The folks that have identified are all from different pods. So the distancing is interesting. What do they have in common? They all have the temperatures. They all have the joint aches, if you will, and they're all just really not feeling well.
I guess in terms of what they have in common, do they all do something or were exposed to perhaps something that, aside from working in the same area?
No, they're all doing the same type of mission. One could be a operations officer, one could be a planning officer, one could be a logistics officer. So they're all doing that type of work, the administrative push, if you will, to get things out the door, but they're all in that one facility.
Okay. And Dr. Shaw, just a quick question for you. I think in weeks past, you've said that on Thursdays, you maybe learn a little bit more about the state's use of remdesivir. Did that still happen today? And if so, can you tell us a little bit about how that's being used here in the state?
I did not participate on today's remdesivir call because of the situation that Director Rogers and I have been talking about. Remdesivir continues to be used. There are emerging data that have come out nationally. Most recently, a paper in the New England Journal that was just published looking at some of the open questions around remdesivir. So we're continuing to learn more and more about remdesivir, and not just so much when it should be used, but in which category of patients. And as we learn and read more about that and get briefed from our colleagues at the US CDC, our goal is to try to flip that information to healthcare providers. I think the latest data show what many clinicians have been asking, which is that remdesivir is probably not the panacea, but it is part of the overall approach, the overall portfolio that clinicians have toward treating COVID-19.
Thank you both.
You bet. We're going to turn next to Charlie from the BDN.
Yes. Hi, Dr. Shaw. I guess my first question is about the workers in the Emergency Operations Center. Have you or Governor Mills or any other senior level officials been tested for COVID-19 in connection with those cases, or may you be in the next few days?
So Charlie, after Director Rogers and I spoke early this morning, we both did an analysis as well as asked our staff to do an analysis of essentially what amounts to contact tracing. We looked at whether we had had any close contacts or indeed any close interactions with the 7 individuals who have developed symptoms. It turns out that neither Director Rogers nor I had such close contacts. The same is true of Governor Mills as well. And so for that reason, I have not been tested. I don't have any symptoms. And so there's not at this time no reason to think that I was exposed. Director Rogers, I believe your analysis led you to a similar conclusion.
That's correct. I have no symptoms and I feel fine.
Mm-hmm. And Charlie, I think, even though it's a workplace, it is a large workplace. And even within that workplace, there have for months now been steps taken to separate physically as much as possible. And as I think I mentioned a moment ago, even within the workplace, we do Zoom calls with people who may only be 20 feet away just to minimize the amount of face-to-face interaction that we've got.
We have often actually had up to 70 people in that facility before. When we have a full activation, we have all of our emergency response team in shoulder to shoulder. At this point, we went from 70 down to 14.
Mm-hmm. And then just, sorry.
Yeah, go ahead, Charlie. Yes.
Oh, just following up. And then how much, so I hear everything you're saying. How often are you, Dr. Shaw, and again, Governor Mills or some of the other top level people, even in there, even with some of that other distancing stuff?
Mm-hmm. So I'll start. I have So ever since Maine CDC and Maine Emergency Management joined up our operations, I've spent a large part of my mornings at MEMA and then back over at Maine CDC in the afternoons. Even though I'm at MEMA, it's again, I'm usually in an office there on Zoom calls with people that might only be a couple of feet away. Director Rogers and I have been on more Zoom calls, even though his office is literally right next door to mine at MEMA. Part of the reason that I'm over there is because it's good to, we have Maine CDC staff there, and then of course we've typically done the press briefings there. So it's been easier for me just to get everything I need and walk down the hall. That's been the principal reason for my co-location there.
Thank you.
You bet. I'm going to turn to Kate Koff at the Ellsworth American.
Thank you, Dr. Shaw. So I have one question for each of you. My first question for Director Rogers. So I'm assuming that the state had pandemic preparedness plans kind of in place before the crisis. Can you talk a little bit about what those plans looked like and maybe how the situation on the ground has differed and what you've learned so far?
Sure. We do have a pandemic plan. We have looked at it, and when this was starting to rise overseas, we actually got that out. We talked with our staff. We went over that. We looked at it. Certainly, I don't think anybody saw what was coming as quickly as it came, but I will say that the state of Maine really leaned forward early on this. So we were dusting off plans. We were talking about it. The CDC and Maine Emergency Management started a unified command in that Dr. Shaw is a commander, I'm a commander together. We make joint decisions based on their side, on our side, and it's gone very well. So we train, we test, and we do have those plans.
Kate, I would just add on top of that, as recently as late November of last year, Maine CDC and Maine Emergency Management convened a full-scale exercise and a scenario that was quite similar to what we're contending with today. That scenario was a full-scale exercise on pandemic influenza. What we're dealing with is pandemic coronavirus, but obviously the issues were the same. So we have exercised our plan as recently as a month before the coronavirus became started seeing outbreaks in China.
Thank you. And then my second question, Dr. Shaw, could you update us on the situation at Birch Bay Retirement Village in Bar Harbor? I correct me if I'm wrong, but I understand that you were recommending universal testing, and then we saw a facility update on Friday that said that there were no cases among residents or staff. And so I'm just wondering where we are with that and if universal testing has been done.
Kate, good question. I will check with our team on the latest there, and we'll make sure we get back to you ASAP.
Okay, thank you.
Next up is Steve Missler from Maine Public.
Can you hear me okay?
Yeah, go ahead, Steve.
Great. Just a couple of really quick questions. Director Rogers, I think you mentioned that the EOC I think you were referring to the on-site employees had gone from 70 to 14. Does that mean that with these 7 people ill that the EOC on-site workforce has been cut in half? Is that accurate?
Yes, although we have redundant systems, Steve, where we have people ready to fill in if somebody goes down. For instance, my acting deputy has been distancing through this whole thing in case something happens to me. We have other staff that are ready to fill in with those positions, which is what happened today. We had a number of folks come in, and they've been rotating through these positions anyway. So redundant systems, so there are people who can step in immediately and keep going.
Okay.
And Steve, I would chime in from Maine CDC. We have the same architecture in place. For example, for most of my senior deputies, we haven't been in the same room together in almost 3 months.
Okay, thank you for that. And just a clarification, you mentioned the P&G facility, the factory outbreak. I'm assuming that's in Auburn, but can you confirm?
That is correct, Steve.
Okay. And has CDC deployed universal testing there?
Steve, actually, as it turns out, right before this, there was a call amongst our teams from Maine CDC and the representatives from the factory, literally right before this call. I was on the first 30 minutes, but not the remainder. I know that universal testing was discussed, but we'll get back to you and let you know exactly what the resolution and the plan is there.
Okay, thank you for that. And then just one last thing, and this is just an observation from someone who's been into the MEMA facility, gone through the screening and everything else. It strikes me, now I haven't seen the whole building. Strikes me as very tight space. Now, maybe you guys are working in a split area that's much larger. And I ask that because given the tight quarters that it is, and if 7 people suddenly fall ill, and again, we're not confirmed cases yet, but if they are, how much cause for concern does that give you? Sure.
Yeah, Steve, and I will say, I think the last time you were in, things have changed quite a bit. We've totally reconfigured our EOC position. We have different pods set up versus, I think when you were there last, it was long rows of tables, and that's changed drastically. It's still tight at those tables when we're fully staffed. In this case, we're looking at usually two people per pod or per table if you are, and those tables are very big.
I would chime in on top of that, Steve. In terms of the room itself, it's actually pretty cavernous. It's got 20-foot ceilings. It's a massive room, and even though it's fully staffed, it's just a smaller number of individuals who are on site. Steve, I wonder if you were thinking perhaps of the media room as opposed to the emergency operations center. The emergency operations center is pretty cavernous.
Okay. Yeah. I mean, that is my experience, not having been in the other one. But even as you enter the media room, it seems tight in that area. And when I was there, again, this is a long time ago, because we were, because of the way the briefings have changed, there were a lot of people there. But maybe you guys reduced the staff since that my last time in that facility.
Mm-hmm. Yep. And the last question today goes to Megan from WMTW.
Thank you for taking my question, both of you. The first question is, I'm sure I understand that those 7 employees have been tested. Is it anyone else been tested who has had close contact with those employees in terms of family members, household members, or people that I know that universal testing was something that you were talking about and have yet to decide, but has anyone else been tested other than those 7 employees?
So at this time, Megan, the answer is no. It's just the 7 employees who have displayed symptoms. Based on where we go and what we learn from that, we'll follow the algorithm, the decision tree, and expand the scope of individuals who might need to be tested.
And then just to follow up, in terms of what is being done now to kind of figure out what theoretically could be in the building and how you disinfect the building, can you talk about what the steps are now going forward in terms of cleaning or any kind of precautions?
Sure. So I'll start, and then Director, I'll kick it over to you. From a public health perspective, if we have a single confirmed case, then we'll move to offer testing to anyone who's been in the EOC in the window in which they could have potentially been exposed. The second thing we'll do is continue what's already been happening, which is the process of determining who has been in contact with whom, contact tracing. And then the third is work with our colleagues to get a deep cleaning undertaken of the entire MEMA office, not just the EOC, which again is quite large, quite cavernous, but all the other hallways attendant to it. And that's the process that we'll follow. That is the process that we follow for workplaces, and it's what we've advised and worked with other such corporations and entities to do.
Okay.
Great. Director Rogers, anything else on your end? Oh, I just see, I'm sorry. Brad Rogers. Brad gets the last question for today.
Hi, can you hear me okay?
Yep, go ahead, Brad.
Okay, thanks. I was just curious if these individuals who became ill, were they wearing masks or face coverings in there, and were they practicing physical distancing in the EOC center?
Hi, Brad. Yes, they do. They practice extreme distancing. They sanitize their hands every time they come in. And we also have something that we started probably 2-3 months ago where we do regular wipe downs of all of the equipment. So during the course of the day, we pause, everybody gets the wipes out, they clean their phones, their microphones, their computers, the tabletops, everything in that facility is wiped down at that point. Again, social distancing is key, and we're always reminding people if it looks like they may be getting too close to separate. We have not had a number of meetings, traditional meetings, in a long time. As Director Shaw said, he and I will be on a Zoom meeting, and we're literally 10 feet away in a different room.
So, Dr. Shaw, that sort of means, and we know this already, but it certainly speaks to how infectious this disease is.
That's exactly right. I mean, Brad, you put your finger on it. This is one reason why this outbreak is so challenging. It spreads very quickly, and it can spread during that time before individuals have symptoms. And I should stress that the test results are still coming in, or we're still waiting for the results. We're at a time when there are other viruses circulating. It's a time when we're in spring and viruses can be kicked up. So we are still waiting for the test results right now. Once we have those, we'll have a better sense of what our response will look like. But at this time, we haven't received any of the results yet. This is being done as part of good public health in an abundance of caution and in order to be aggressive to make sure that our state's response continues uninterrupted.
Thank you.
You bet. Director Rogers, anything further on your end, sir?
No, I guess my final message is just a reminder that there is no interruption in state response to the pandemic. We have backup staff that fill into the roles when people do get sick, and we are continuing to complete all of our core missions.
Great. Well, thank you all very much. We do appreciate everyone who's tuned in, as well as our colleagues in the media joining us. We hope this format worked and that everyone was able to get the information they needed on the latest for the COVID-19 situation. We will keep everyone posted as we learn more. But in the meantime, thank you all for being flexible with us as we've changed course a little bit with our daily briefings. As always, please take care of one another and be kind. We'll talk soon.